Hi, I'm Kathy Kolasa, Professor Emeritus at the Brody School of Medicine in the Department of Family Medicine. I'm here today to talk with you about other approaches to weight management. This module is a special training module. It's not part of the Eat Smart, Move More, Weigh Less curriculum, but rather the information that I'm providing to you should help give you additional background to be an effective instructor. As you can see, I am recording this on December 5th, 2014. The information may change. In this area, it changes rather rapidly. If you have any questions, please contact me at kolasaka@ecu.edu. I travel a bit because I'm retired, but I stay pretty good in contact with my email and should respond to you rather quickly. Or contact Dr. Carolyn Dunn at NC State University. This module is called Other Approaches to Weight Management because it is about things like special foods, dietary supplements, medications, surgery, and more. I am a registered dietitian nutritionist, and until 2014 I had an active nutrition practice at the East Carolina University physician's practice. The objectives for this module are at the end, you'll understand the current evidence for dietary supplements, medications, and surgically assisted weight loss. This has changed a bit since the last time I recorded this, so if you've seen this before, you might want to update yourself there. You also will be prepared to answer basic questions from participants who may be using or contemplating dietary supplements, medications, and or surgeries, or refer to an authoritative source. And again, in this area, there's been quite a bit of change since I last recorded this presentation. Where there hasn't been much change is where's the evidence. There continues to be strong evidence that low-calorie diets, combination of diet and exercise, intensive behavioral therapy, prescription medications, surgical interventions for select patients all have strong evidence that they can help people lose and maintain their weight loss. There is little positive data about hypnosis, although there's a little bit more about positive aspects of acupuncture than there used to be, and not too much about alternative medicine. I wanted to make a comment about sleep before we went forward. It is particularly important that individuals who are trying to maintain their weight achieve 6.5 to 9 hours of sleep a night. I know your Eat Smart, Move More, Weigh Less magazine says 7 hours, but there is a range that makes sense. Your risk of obesity goes up. Your risk of type 2 diabetes and other chronic diseases go up if you have less than that or more than that. Still don't know exactly why. Perhaps there's a change in the energy balance or appetite hormones of leptin and ghrelin, which will alter the ability to signal caloric need and produces internal misperceptions of needing calories. There also is some, particularly for children, issues related to growth hormone. If you don't get enough sleep, you're not going to have appropriate growth hormone. Reduced physical activity happens if you sleep a lot. And it seems that people crave or choose higher fat, higher calorie foods if they're not sleeping enough or sleeping too much. We also know that night eating or eating at the wrong time of day is related to cognitive impairment. You can learn more about sleep at http://yoursleepassessment.net.org. I also wanted to remind you that there are medications that are associated with weight gain. You may have participants in Eat Smart, Move More, Weigh Less who are taking medications that really make it almost impossible to lose weight and may even support weight gain. And what we always tell the individuals is that they need to talk with their physician. If the medication is absolutely necessary for their health, then they need to try to limit the weight gain that occurs. If there might be an alternative, they could talk with their doctor about alternatives. I find often that patients who are taking prednisone, for example, and there's a lot of prednisone that is prescribed for a wide variety of problems, gain weight, and so their goal may be just to minimize the weight gain while they're taking prednisone. There are a fair number of the anti-inflammatory medications that support weight gain, Even some of the medications taken for controlling blood pressure are positive in terms of weight gain. Depo-Provera or progestins used for birth control. Clearly, patients who are taking insulin and some of the other anti-diabetic medications are prone to weight gain, although there are now a few, and I'll mention them later, medications which actually, for diabetes, which are promoting themselves as weight loss. Some antihistamines, some anticonvulsants, some antidepressants, some antipsychotics, and this is particularly true of what are called atypical antipsychotics, which are given to children with behavioral issues. And even some of the heavily advertised medications like Lyrica that provide pain relief for fibromyalgia may be contributing to weight gain. Again, this is something that patients need to talk with their doctors about, but it is surprising how many of them are taking medications frustrated by their weight gain and didn't know that their medicines were contributing to that weight gain. In 2013, the obesity guidelines, which were originally published by the National Institutes of Health in 1999, were updated, although this time they were not updated by the NIH. NIH in 2013 announced that they were getting out of the guideline business, and so this was produced by a consortium of different organizations. You may want to read this document, or at least take a look at the executive summary of it. They have not particularly changed since the 1999 guidelines. They only reinforce some of the activities that were promoted. And so we know that comprehensive lifestyle interventions alone or with other therapies are appropriate for patients who have a body mass index of greater than 30, or 27 if they have a comorbidity like hypertension or high cholesterol. If you have a body mass index greater than 30, you may be interested and be helped by taking some kinds of medications in addition to, but not without, comprehensive lifestyle intervention. And they're still using, although many surgical practices will use a lower BMI, and even some of the insurance companies will use a lower BMI of 40, less than 40, for referral for bariatric or surgical intervention. I might mention that we are expecting in 2015 a specific guideline related to medications. They really weren't dealt with very much in the 2013 guidelines. Before I get into the discussion of treatments, let me comment about other dietary supplements. Every time your participants go into a store or watch a television or look at their web, they're going to see some kind of dietary supplements or dietary products that are advertised. Particularly when people go into pharmacies, they think that if they're sold in a pharmacy, they must work and they must be safe. But unfortunately, those assumptions aren't always true, and so I want to talk about a few of them. This in particular is an old slide of mine, but I like it. It says, "Eat all you want and still lose weight," and we couldn't say it in print if it wasn't true. Unfortunately, that is not true. We have very little control over the advertising world for dietary supplements, and as you may know from other areas of study, the Food and Drug Administration has very little control about claims made for dietary supplements. There are many pop-up ads, and different times of years you're going to see even more of them, particularly right after Christmas and before the bathing suit season, where you get what I consider to be very annoying pop-ups that promote or tell you that they have weight loss plans or weight loss supplements that work. In this particular one, where they talk about 5 foods you never need to eat or never should eat, if you click on the 25-minute slideshow, which I did, it really is about a diet that they're trying to sell, and they never did tell me why I couldn't eat bananas. There are lots of bloggers writing, and it may be important and helpful for some of your participants to follow a blogger. Here are some criteria about which bloggers you might believe in or think or follow, and maybe you have one or two that you like and you might even recommend to them. A blogger about weight management should be written by a registered dietitian nutritionist or a qualified professional. Needs to be current, needs to accept comments from readers, needs to think about food, nutrition, and health, not just weight. Needs to have an about section with information that tells us something about the blogger, the author, identifies his or her training and experience. The overall focus of it should be educational versus promotional, although many people are trying to promote themselves or their services if they blog. But the focus should be more about providing information. Clearly should be evidence-based, scientifically sound, and not violate the intellectual property rights of others, and to consistently abide by ethical principles of blogging. And I've provided you a website here, www.nutritionblognetwork.com, where you can learn more about bloggers. Dr. Oz has a popular television show. I actually am surprised how many people don't realize this, although I must admit they are mostly men that aren't aware of Dr. Oz and his work. This slide depicts a list of 28 supplements one of my patients purchased on the recommendation of Dr. Oz. She brought in her bag of supplements and said most of them were to help her lose weight. Dr. Oz does use lots of phrases like miracle and unprecedented breakthrough with staggering results or revolutionary product. We kind of smiled in 2014 when he went before a congressional hearing to complain that people were using his likeness and his words to sell their products, and instead he was chided by the congressional leaders for misleading his audiences with the information that he provided and used to promote products on his show. When a patient brings me a whole bag of dietary supplements, I like to take them one by one, ask them why they take it, who recommended them for them, and I actually do ask them how much they cost as well, to help them figure out if they really do work for them in any way. What I also like to tell them is to be aware of or to be careful if somebody promotes a pill or food as miracle or revolutionary, or if the pill is said to raise metabolism or block absorption of fat or calories or keep you from being hungry, or if they brag that the ingredients are natural supplements or natural substances. I also say, if you would be embarrassed to tell your doctor that you're taking this particular supplement, or perhaps even if a salesperson warns them that they should not tell their doctor about taking the supplement, that should be a really big red flag. If the supplements guarantee rapid and large weight loss, you know it's got to be too good to be true. If it is described with emphatic language and lots of exclamation points and written in all capital letters, you know that that probably isn't true. If testimonials are provided, that's nice and may work, but it is not good evidence just because somebody said that it worked for them. It's important for each Eat Smart, Move More, Weigh Less instructor to have a philosophy about dietary supplements. Some instructors, based on their experience and training, may be able to advise participants, such as a registered dietitian, nutritionist who follows this information. Others may be only able to help the participant think through the risks and benefits of taking a particular supplement. There are now, in 2014, more than 85,000 distinctly labeled dietary supplements on the market, and there is about 1,000 supplements added every year, so none of us can know all about them. The Office of Dietary Supplements has a website that provides information about the major supplements, and once again, I invite you to email us questions if you have them. So I'm a registered dietitian nutritionist, and my scope of practice allows me to provide advice, and I have developed a philosophy that I, one, promote strategies known to be effective. So if I know that women and children are low in dietary calcium, and I work with them to increase the calcium from their diet and just can't get enough, then I'm going to promote the use of a calcium supplement. I'm going to warn all of my patients and consumers against those that are dangerous. And this list is actually quite small that the Food and Drug Administration has listed as dangerous. Ephedra is one that actually is an effective weight loss supplement, but it can cause death. It can cause hypertension. And so it obviously is not safe for individuals to use. I also warn patients to not purchase products that have been recalled, but they still can buy on the web or in a marketplace. And I also discourage them from buying products of unknown reliability. I subscribe to www.consumerlab.com, which actually has a lot of information for free, but for a small subscription fee, they actually give you information about dietary supplements by brand and can tell you which ones are unreliable. But for most of us, what we're going to do is inform and help our participants or patients assess the risks and benefits from emerging therapies. And so that's when I ask them again, why did they take it, what helps them, what doesn't help them. Dietary supplements sold specifically for weight loss are reported to have different modes of action. Some include ingredients that are believed to promote increased energy expenditure. Some of those are Ephedra, bitter orange, EGCG found in green tea, Guarana Caffeine Country, mallow, Yerba. There's some evidence that Ephedra, I already mentioned, is effective, but it is not safe for most people to take it. Although there are individuals who can take it safely, but we just don't know who they are. There is growing evidence that caffeine works, and so you are likely to see products marketed with caffeine as an ingredient. But remember that caffeine taken in dosages of greater than 200 milligrams per day can be unsafe for some individuals. It can increase the risk of a spontaneous abortion in a pregnant woman. It can cause headaches, jitters, and insomnia. Some ingredients like chromium and ginseng are thought to change the way that our body metabolizes carbohydrates. Some ingredients like guar gum, glucomannan, and psyllium are thought to increase a person's feeling of satiety or fullness. There are also ingredients that are thought to reduce fat production. They can include L-carnitine, hydroxycitric acid, EGCG, licorice, vitamin B5, conjugated linoleic acid or CLA, and pyruvate. And some ingredients like chitosan are thought to block dietary absorption. So, if you were going to want to increase your feeling of satiety, you would try a supplement like guar gum or dietary fiber. Some of these may work for individuals. Again, we don't know who each of these dietary supplements might work for, nor do we know very much about what the dosage should be. This chart shows some of the popular weight supplements and my personal interpretation of the available information or evidence about them. So you'll see here Orlistat, which actually is not a supplement. It is a medication or drug. It is an over-the-counter version of Orlistat. And yes, we know it is effective. You must limit your fat to less than 15 grams per day or you're going to have bad side effects. And it will block up to 25% of the fat that you eat, or about 108 calories per day. I already mentioned caffeine may be effective for some individuals, but be careful at doses over 200 milligrams a day. We really don't know much about glucomannan. We think pretty much that the doses that you can buy are not large enough to create the satiety that you need from this particular supplement. 2 to 4 grams per day is the dose. That can get pretty pricey. Hydroxymethylbutyrate, we're not sure of. It's promoted as increasing lean body mass at a dose of 3 grams per day. Cortislim is an interesting product, and it's an example. There are many of them like it, but this is one that has been well known to be charged with fraud. What happens is the company makes something, promotes it, is charged with fraud for the comments and statements that are made. They pay the fines and keep selling the products. They're making more money than the fines that they consider really a cost of doing business. Hoodia is an interesting appetite suppressant, and it is known to work, but again, the dosages need to be quite high. And what is a concern is there enough out there? Can they grow and produce enough actually Hoodia to sell appetite suppressants in the volume that we're seeing them on the marketplace? And Ephedra was banned in 2004. Some of my physician colleagues recommend 5-HTP precursors to serotonin to their patients at a dose of 300 milligrams per day at meals. That you can create some weight loss, maybe up to a pound a week. What you need to be very careful about with this is that a person should not be taking any other kind of medication that would be promoting antidepressants or anti-anxiety at the same time. Green tea, or EGCG, has been shown in some trials to reduce body weight by about 4%, also to reduce waist circumference. Grade B evidence means that it's good evidence, but there isn't a lot of evidence. And so we know that the dose is pretty large, somewhere between 125 and 800 milligrams a day, which could be 4 to 10 cups of brewed tea. That by itself might keep you in the bathroom most of the day, so you could be losing weight that way. Patients who are taking Coumadin have to be very careful with this because it is a vitamin K source. There are a variety of products called hydroxycitric acid or Garcinia cambogia. Again, the effectiveness isn't really very well known. It may be unsafe for people with diabetes due to its hypoglycemic action, although there doesn't seem to be any toxicity at doses less than 2,800 milligrams a day. A few years ago, the product was pulled because it was contaminated, but it is now back on the market and appears to be free of contamination. Green coffee bean extract has been very popular. There have been a couple small studies with conflicting results. Independent labs suggest that the amount of the product chlorogenic acid varies greatly in the products, and so it's hard to know which one really is appropriate to take. Many products are advertised to rev up metabolism, and since people often feel that their weight is due to slow metabolisms, these products seem to be very attractive, and so people tend to buy them. There are a few that are kind of fun. Sensa Sprinkles is out there. It has been gone to court over a couple lawsuits that they were making false claims. They've lost those lawsuits. They contain maltodextrin, tricalcium phosphate, silica, natural and artificial flavors, soy and milk ingredients, and they form into a little sprinkle that they call tastants. They claim that if you add this to your food, it enhances the food's fragrance, triggers the brain mechanism to signal fullness, and so you eat less and feel more satisfied. I've actually had patients who use this who find it helps them for a little while, as long as they're not spending a huge amount of money, and understand that it isn't a miracle drug. It's not a bad thing to do. It may not be a good thing either, but it's not a bad thing to do. Capsaicin is kind of fun. It's cayenne pepper. It can cause GI upset and topical burns. Some people say that it revs up your metabolism. And once again, here's another example of something that Dr. Oz has promoted, raspberry ketones. At the time that he was promoting them, there were no human studies, only studies in mice about its effectiveness. And then I think, if I recall correctly, he did an audience, a studio audience test with them, and of course the studio audience lost weight. You might see ingredients put into a patch These are no more effective than taken in pills. What's important for you to know is that patches as a delivery mechanism are regulated by the Food and Drug Administration, so the patch has to be appropriate and safe, but the ingredients are not regulated, and so the manufacturer can put anything into a patch that they like. I've already mentioned the 5-HTP as something that some of my physician colleagues have encouraged their patients to take. But again, do not take them if you are already taking a medication for anxiety or depression. There is emerging evidence that eating a higher protein breakfast can help. The data so far are in women, although I've heard preliminary research reports that it works just as well for men. Looking for products with 25 grams of protein, with at least 6 grams being leucine, the amino acid leucine. This is increasingly available in shakes and in some cereals, and so it may be something that an individual might want to try. You probably have seen commercials suggesting that not only eating breakfast, but eating a high protein breakfast can aid weight loss. Some energy drinks are promoted as weight loss beverages. They commonly contain caffeine and EGCG. Some energy shots may have up to 200 milligrams of caffeine in them. Although you can get that amount of caffeine in a large premium coffee, the shots are taken quickly, and so they spike the caffeine levels. Some of the manufacturers put B vitamins in the drink, which can exceed upper tolerable limits and actually give a niacin flush. Some people actually think that's a good thing. They think that means that the product is working. Obviously, these products have side effects like headaches, jitters, irritability when the dosages are over 200 milligrams. Some of our participants may believe in fasting, cleansing products, and diets or detoxification diets. Many are heavily promoted by celebrities, and these products, including their caloric value, vary greatly. One product that I looked at had 39 different plant ingredients listed, but no indication of amounts. I saw a colonic irrigation kit, which instructed the users to use 16 gallons of water. You can actually view the use of these kits on YouTube. They're quite amazing to watch. I would find them discouraging to use, but obviously some people think that they are useful. A systematic review of the literature found no studies that demonstrated benefit, and there are concerns, especially for electrolyte imbalances that could lead to malnutrition, fainting, and in the extreme, death. So you can tell patients or participants who ask you about these type of products that the body naturally cleanses the toxins through your livers and kidneys. Colon irrigation is unwise, particularly if you have any history of GI disease. There are a variety of side effects like nausea, vomiting, diarrhea, dizziness, dehydration, electrolyte abnormalities, acute kidney insufficiency, pancreatic, bowel perforation, infection, and heart failure, although you'll see that's a level C, so it's not strong evidence for heart failure. The devices, such as the colon tubing kits that are used, are not approved by the FDA for colon cleansing. Those tubing kits are approved by FDA, but for other medical reasons. And typically, the practitioners are not licensed by traditional academies. Weight loss fads tend to reappear, although this one's been around for a little while. The use of HCG, or human chorionic gonadotropin pregnancy hormones, was promoted in the 1960s. After it was found to be ineffective, physicians stopped giving these injections. But the practice has emerged again and is sort of sticking around. I was at a resort over Thanksgiving, and there were many of the spas that were providing HCG treatment for weight loss. There are also physician offices offering these injections to help patients adhere to a 500-calorie diet. And it's also possible now for consumers to buy syringes filled with this substance or tablets that are put under their tongue. You can buy these on internet sites. There is no evidence of effectiveness. Even if someone chooses to try this, they should be careful to make sure that the source that they get is not contaminated. In my world of physicians, they're very concerned about this fad because they are afraid that it will deplete the actual supply of HCG that is needed to treat real endocrine disorders or infertility among women. So the use of this for weight loss is discouraged by most physicians. I can't explain yet why people tell us that they lose weight dramatically more than the 500-calorie diet could give them in a short period of time. Of course, the magic bullet for weight loss changes all the time. You can't be expected to keep up with the wide variety of different dietary supplements marketed for weight properties, as I've already mentioned. Even if a supplement is talked about by Dr. Oz or Oprah, doesn't mean it's effective or tested for safety.